So I want to begin this my talk with a case that came on Friday evening. When I was Friday sitting in the seminar, I had many emergency SMSs from this person who is 81 years old and also a very close friend of mine for 40 years or more. And he is 81 years old, and I have seen him so often as a patient, as a friend, very alive, very bubbly, always full of energy. He even wanted to come and attend my lecture here. And I have never got so many urgent SMSs from him. And I asked Dr. Mansi, my assistant, to speak to him, and I got an email which I read, and the email read this way, that dear Dr. Jayesh, dear Mansi, all dear Hitesh, everybody who works with me, I am very depressed. I am coughing all night. I have got a lot of fever. Night I was coughing. I wanted to go to the bathroom. I felt so weak, I'll fall down. I'm so depressed. It just feels as if I will not recover from this. I'm just going to fall any moment. How can I live my life like this? I think I will not get well this time. From a person who is so alive all the time. I was kind of surprised by the tone of the email. So I just called him up and tell me a little more about your cough. And he said that the cough started morning as soon as I rose, rising from the bed, and then it was okay after some time, but night after I was lying down, it went on and on and on and on, and I got fever, and this was his state. This is all he told me. So, and his body was aching, and from medical point of view, I could know that he is very toxic. So all I did was, like how Rajan pointed out on the day one, in the acute, like Sujit said, whatever shows up, run with it. Don't wait just now. Whatever is coming on the surface is the most important thing. So all I did was, I opened my repertory, and when I opened my repertory, it was very interesting. Can we have my thing here? Is it there? When I opened my repertory, then I just took this rubric, cough in the morning, rising after, evening, lying down, and. Can you imagine? There is exact rubric like this. Cough in the morning, rising on, and in the evening, lying down on. I was telling you first day, sometimes exactly what the patient says is there in the repertory. Then I took the second generalities, weakness, cough during. And then I took the rubric, expectoration that he had, greenish morning on waking, expectoration greenish evening on lying down. And then his most important mental symptom I saw was despair of recovery. And I asked him what his despair of recovery was. He said, I can't stand, I'm feeling so weak. So I took despair of recovery, weak, with weakness. Now can you imagine that weakness of recovery is, all these rubrics are just covered by one remedy. Why is this okay? And you can see these rubrics. These rubrics are covered by one remedy, that is Sorinum. And he was very chilly. I gave him 1 dose of Sorinum. And you should see the SMSs I got yesterday. Oh, thank you. You have always been a miracle doctor. That 1 dose has taken everything away. I have no fever, I have nothing. He was, yesterday evening, his phone call was like he would have almost flew into my car and given me a hug. So every aspect of the case came through very clearly, because in my clinical understanding, Sorinum is my specific for despair. If somebody asks you which is your specific for despair, if somebody is in very much despair, in between my prescriptions, I sometimes give Sorainum. And this looked like not only that despair, but it also looks so many other things, symptoms with it. In this time, I don't want to think about anything else. I just want to give this and have the confidence that this will do the job. This is what Dr. Suchi taught us yesterday. Just run with what shows up. However, I wanted to show you this case so that after seeing my presentation, you don't think that I am not doing this. Every single day I am doing this. This only adds, there are newer ways coming up and they excite you. That doesn't mean that you are not excited about the older ways of working, the most fundamental ways of working. They are as important. In this moment, I would like to say only one sentence that comes to my mind is that, okay, today I'm going to show you some cases where I could see something which I could have not normally seen. So it is like you are seeing something, and all homeopaths are trying to perceive, trying to see something, trying to discover, trying to look at newer ways. And when I look at what I am looking at in this moment, I feel this is the only thing I'm seeing and I'm excited about it. But I don't have to forget that I am standing on the shoulders of all my masters, all my teachers, right from Hanuman to Rajan Shankaran to my students who have taught me and are teaching me. And I'm standing on their shoulders and seeing something. So whatever we have been doing from the day one has been further building up on what is already there in this beautiful science of homeopathy. And I know that the secret of our success, I can take all the teachers, including Dr. Rajan Shankaran, is every time when we were at whatever stage of evolution as a homeopath, we were always excited about what we were doing in that moment. And we always trusted and believed that this is the best and this is it. So in my day-to-day practice also, for me, what is important is this is it. I do my best. Whatever is there in this moment has to be truth. That's the only way we can evolve and grow. Otherwise, you will look at masters doing cases here and you will feel inferior. I cannot do this. It is like what you do the best in your clinic should be such that you can evolve, you can grow out of it. All these methods are only meant to show you that there is one more way. And that is the way that I want to present today, a kind of a methodology which has really excited me in some ways because it has opened some new doors for me.